One of the things that's begun to happen, particularly in America and beginning to come to UK and Europe, is this. Because I emphasise the consumer so much, the consumer now expects to pick up a smartphone and have on it the readings of how many steps he's walked, what his blood pressure is, etc. And he expects that to be sent to whomever he decides it ought to be sent to. And so we're all much more interested these days in our own health. So one of the big things in the world in future will absolutely be enabled by digital, because if it's not digital, it ain't going to work, is very simple. We must use the power we have in our hands and our smartphones to be better managers of our own health and look at the NHS and other systems as being sickness services as opposed to what they are currently called, which is health services. What's interesting is we in the European Connected Health Alliance spend a lot of time outside of Europe, in the US, Canada, and in China. I'm just back from China, for example. In China, they have decided to make another great leap forward, as they call it, and that is in healthcare. They admit that they have spent so long now fixing their infrastructure and bridges, roads, tunnels, planes, bullet trains, all of that. What they've neglected, and this is the official line in the 5-year plan from the Chinese government, is we have neglected to create the soft infrastructure necessary to deliver better health and social care to our many, many citizens. A statistic in China which is fascinating is that within 5 years, there'll be more people in China aged 60 and over than those under 16. Think about that statistic. That means that there'll be a smaller workforce to support the older people. It also means that the older people need to be enabled, really enabled to care for themselves. And that can be done through the 650 million smartphones that exist in China.